Unfortunately, I was fat shamed a few years ago. I went to the doctor after a car accident, and he was supposed to do some work on my back. And while I was there, he told me that at the time, I was 100 pounds, almost 100 pounds heavier than I am now. And he told me I should just go ahead and have bariatric surgery done because I was never going to be able to lose the weight naturally, and I was just going to be back in a few years asking for his help.
I was gaining weight like crazy, and I would go to my doctors for help, and all they ever said was to work out harder, eat better. They said that I had fat genes. They said I would always have a weight problem. They disregarded all of my other symptoms and said I was crazy. And this went on for about 8 years, and I finally did my own research and discovered I had a brain tumor, and that was causing all of my weight gain. And a year ago, I had brain surgery. I had the tumor removed. Since then, I've lost 40 pounds.
We're back with our investigation into fat shaming. Could you be fat shamed by your own doctor? Where's the line between concern about weight and fat shaming? Dr. Jennifer Caudle joins us now. We are hearing more and more stories of patients saying they are fat shamed by their doctor. But why is there an increase?
Well, first of all, it breaks my heart. This absolutely breaks my heart as a family doctor to think of, to hear. And I'll be honest with you, we're doctors. I'm not entirely surprised. And I don't actually think this is new. I think we're hearing about it more now because people are willing to talk about it. We're willing to record it. We're willing to have conversations. And things like social media has really opened up the platform to really share our stories and compare experiences.
So give us some advice. Give the average person watching you some advice as a physician. How do you know if your doctor's just, doing his best or crossing the line
into the shaming?
Into the shaming area.
Yeah, this is what I always say. I say, trust your gut. If it doesn't feel right, if you don't feel right, if you feel shamed or humiliated or criticized or embarrassed, you know what? Believe yourself. Believe exactly how you feel. And a doctor wanting to do the right thing does not excuse making a patient feel any of those ways. That's never okay. And I say as a doctor, and we're both doctors, but I'll say if you have a doctor that makes you feel that way or you're not comfortable, I'm giving you permission right now to find a new one.
Let's give you some numbers around this. Studies have found, hallelujah, that overweight women are less likely than average to get preventative care like pelvic exams and breast exam and mammograms. There's no excuse for this.
No.
But people treat overweight people differently. What is the right way for a physician to address a patient's weight, do you think?
Well, I think there are a few things. And first of all, as physicians, we've got to be talking about this, okay? These are discriminatory practices. It's wrong. We have to talk about it and be very cognizant of this. But as physicians, we need to talk with our patients. That's not talk at, but talk to. We need to ask our patients questions. What's your journey? How do you feel about your weight? Tell me what you've been doing, what you tried, what your story is. Asking questions is key. And something that we've also talked about is this idea of never dismissing a patient's symptoms just because of their weight. That idea, we shouldn't dismiss patient's symptoms because of anything. Right. We should always be doing our due diligence. So this idea of saying, oh, it's your weight, just offhand, never okay in my opinion. And the last thing is, and this is something a little bit different. I think in the doctor's office, I'm a family doctor, and do I take someone's blood pressure out in a public space, or do I take their pulse or their temperature?
Exactly.
No, never. Yeah. But sometimes in doctor's offices, people are weighed in public places, either in the hallway or in waiting rooms or things like that. And my thing is, all of this should be private, right? This is our personal protected information. It's no one else's business. So there are things as doctors that we can do better to make this a more comfortable and appropriate situation.
Yeah, you guys want to feel comfortable insisting that, for example, you're weighing private, because I don't want you not going to a doctor because you're worried about it.
Yes.
Weight's uncomfortable. I know that's true for a lot of us, but it's a necessary topic. So make sure you're talking about the doctor, not at or with folks as you care about it. I want to bring in Norma, the nurse who we met earlier, who was on the plane and being bullied for it. Come on up, Norma. Norma, what's the best way, do you think, a patient should be able to address their doctor if they're worried about weight issues?
Letting the doctor know, this is new to me. This is an unusual feeling. I've been feeling like this for 2 weeks or 2 months, putting a time frame to it. Yeah. And if the doctor's still not listening to you, change doctors. Always get a second opinion.
That's right.
Always get a second opinion.
Thank you very much.
Thank you.
Let's call as always. We'll be right back.